Now we're going to go on to the upper respiratory system, which we skipped because we thought those things were more important that we did first. And everybody knows you have to remember the middle as well. So you're in your nose, you can have a deviated septum, which is an obstruction of nasal breathing, nasal edema or dryness associated with crusting or epistaxis. Those are signs and symptoms. So signs and symptoms, crusting, epistaxis, obstruction. Severe deviation can lead to sinusitis, and you can manage that with treatment of symptoms or with a septinoplasty, which would be the surgical repair of the septum. Yep. You can also have a nasal fracture. And so inspecting that, you would want to assess their ability to breathe out of both sides of their nose, the scenarios. So you can include one, still good, include the other, still good. Actually, that one was not so good. It's infection allergies right now. But you're going to want to note if they're presenting with edema, bleeding, hematoma, or ecchymosis of the eyes, which would be eczema. You can have a unilateral or a bilateral break. Unilateral is just on one side. Bilateral would be the snatched appearance. You would inspect it internally for deviated septum, hemorrhage, clear drainage.
That's a bad sign.
Bad sign. If they have clear drainage, you're going to want to immediately check it for glucose because that means they have a cerebrospinal fluid leak, and that's not a good thing.
Yes.
You do not want to be taking that stuff. Or if they have like a really severe headache.
Yeah,
too.
a severe headache is also not a good sign.
Not a good sign. Sometimes they might need to do surgery to get it back together, but they might wait until the edema goes down.
I just also want to add that Ashley is wearing a polka dot toga.
I am. If you can't tell in the video, I wanted a blue polka dot toga. I wanted a silky one, but it's a little more expensive.
I'm boring, and I'm just wearing a white toga.
But she looks more like a goddess, and I just look silly. I mean, it's kind of a give and take here. Rhinoplasty, surgical repair of the nose. So if you think your nose is not good, you could get it repaired. And you can have septoplasty, nasal fracture reductions. And if you're going to have any type of nasal surgery, you want to avoid aspirin and NSAIDs 2 weeks before the surgery. And I'm going to get up and jiggle the computer, and Chris is going to talk about nasal packing, her favorite, because she thinks it's gross. Hey, she didn't want to talk about this, and I'm going to make her, because she made me wear an ostomy yesterday.
Gracefully.
This is not the most graceful way to do this. I was incorrect.
Okay, so
Trying to hide the surprise props.
well, Ashley's getting situated and showing you a whole lot of her leg.
Whatever.
This is to keep everybody interested. This is like strip.
It's like
strip study. Yeah.
There's only 2 men in our class.
So
and they're both married.
Dang it.
Ladies,
get ready for some of this. Oh yeah. Okay, anyways. Back to epistaxis, which is a nosebleed. It's a big fancy term for a nosebleed.
Also rhinorrhagia. We might need to edit that because there could have been a little.
Oh,
there might have been a little accident. We need to check.
Okay. It really is strip studies.
I did not want that to happen.
So yeah, epistaxis is the nosebleed, and what should we say about it? It's just,
you can do some packing for that. Basically, you want to apply pressure.
Yeah.
Head of the bed elevated.
You apply pressure for like 10 to 15 minutes.
10 to 15 minutes. It's a long time.
Ice pack. Yeah, ice pack will constrict those vessels.
If it's it's not stopping bleeding, they might do this nasal packing thing, which just looks awful. They start it to your nose.
It comes out your
mouth.
mouth.
Out of your mouth. You have to leave it there for 3 days. You need to read analgesics prior to removing it because it's super uncomfortable. And who can blame you?
You have a huge risk for infection because you have a giant
MRSA in your nose.
You have a giant sponge thing in your nose. It's disgusting.
I don't know why. I think I would just say no.
I would probably say no.
Just say no to nasal packing.
Right. And drugs and cigarettes. And nasal packing.
And high-fat foods.
Yeah.
And lots of alcohol. And maybe jelly beans.
I would say yes to jelly beans.
Always yes to jelly beans.
So, next we have allergic rhinitis, which everybody probably has a little bit of that right now. It's just, you can have seasonal allergies.
You can also have chronic allergies, but seasonal ones are the ones we're having right now.
Yeah, and you can have, how do you say this? Perennial rhinitis, which is caused by environmental triggers, not like allergens, from Mother Nature. I don't know, whatever. This is caused by environmental triggers like dander and moles.
So like chunky or Stachybotrys atra, which is this yeast thing that grows in cardboard boxes.
She said yeast mold that grows in cardboard boxes.
I'm talking about something gross.
Yeah. So there's some signs and symptoms of allergic rhinitis or nasal congestion. That's pretty,
dry, itchy eyes, watery eyes,
sneezing, altered sense of smell, thin, watery nasal discharge. So that one's pretty. If you were to inspect their nose inside, they would have pale, boggy, swollen nasal turbinates.
Ow.
And the posterior ends of the turbinates may be so enlarged that they obstruct the sinus aeration and drainage as a result, so it can be just so swollen in there. Which is actually, whenever people feel like they are just so congested and they have just filled with goop, they're normally not really filled with goop, it's just that everything is swollen inside there, so it gives that feeling. And they don't need to sit there and blow their nose over and over and nothing's coming out, it's just they're swollen. So take some Sudafed.
But not too much.
Right.
Or they'll think you're running a meth lab.
Yeah. Chronic exposure to allergic rhinitis can lead to headache, congestion, pressure, postnasal drip, and nasal polyps. And you would treat this with corticosteroids, often like intranasal corticosteroids like
Which I have in the house.
Yeah. Flonase, which is fluticasone, Nasonex. Yeah.
I don't remember.
There's a couple others.
Probably Enzone.
Flonase, Flonase and Nasonex are the big ones. Mast cell stabilizers like cromolyn, anticholinergic drugs, antihistamines, and decongestants like the Sudafed. Antihistamines would be your Benadryl, Allegra, Claritin, Zyrtec, those type of drugs. So this one, next we have foreign bodies inside your nose.
Kids at home?
Yeah, tell them
this is one time that inorganic is best.
Yes, inorganic objects in your nose actually have a pretty good outcome, like small risk for infection, like
beads, coins, that sort of thing.
Those things are okay.
Infected. They can just like hang out there.
Yeah. Organic items like broccoli or wood or
peas or beans or paper.
Those are bad. They have a high risk of infection if you get them shoved up your nose.
If you get them shoved up your nose.
If you shove them.
Like if you shove them, because normally
most people don't shove things up other people's noses. Well,
Rule 34.
Whoa.
We're not going to explain that. Google it if you want to know.
So Ashley's going to talk about acute viral rhinitis, which is often pretty common. It's just a cold, basically.
A cold, also known as acute coryza. I thought that was cool. It's like it sounds really bad. Like I have acute coryza. I can't come in today. I have a cold, and
yeah, you should use that excuse for work. They'll probably send you flowers and stuff.
Yeah, because they're gonna think you're really sick, but you're not. You're just smart. It's seen more often in winter months. It spreads through droplets. So if somebody sneezes near you and they have acute viral rhinitis, you probably are going to get it too. Signs and symptoms are tickling in your nose, I assume, irritation, sneezing, and dryness in the nose or nasopharynx, followed by copious nasal secretions, something you don't want copious amounts of, obstruction, watery eyes, elevated temperature, general malady, and headache. I always think that's heart attack. No. HA. Headache, not heart attack. Rest, fluids, proper diet, antipyretics, analgesics. Those are the treatments.
Treat the symptoms. There's no treatment for cold. There's a couple of things that claim that they'll treat a cold, but they don't.
So you are going to treat with antihistamines and decongestants. Antibiotics should only be given if symptoms last longer than 7 days. swollen intestines, and a sore red throat. A common cold can lead to pharyngitis, sinusitis, otitis media, tonsillitis, and lung infections.
So those last couple, that's what you would need want to give an antibiotic if they actually had one of those infections. Yeah.
Another thing I'll go ahead and talk about now, since we're on it, is the cold versus the flu. How to differentiate. So a cold, you don't normally have a headache. It would be rare to have a headache. You usually have a normal temperature. It's not going to be super elevated. You have some aches and pains. It's not overwhelming. You're going to have sneezing, a runny nose, a sore throat, and a mild to moderate hacking cough. If you have the influenza virus
or the flu,
you're going to have a prominent headache, the sudden onset of a high temperature lasting up to 4 days. So, like, you wake up in the morning and you feel fine. You go to work and 3 hours later, you're like, Jesus, I'm dying.
Yeah.
More likely the flu is cold. Severe aches and pains, extreme weakness and fatigue, severe cough, chest discomfort, and with the flu, the most common complication is pneumonia.
They can give a couple of medications to decrease the length of flu symptoms,
but they need to be given in the first 48 hours.
Yeah, the most common is Tamiflu. Yeah, I think it's called Relenza. But they don't actually use Relenza that often. Tamiflu is the most common one.
And they hand that shit out like candy, excuse me. Once every episode.
Random tidbit of knowledge, the people that manufacture Tamiflu only make a limited amount a season, because they don't want the drug to become resistant. So they make a certain amount and it's distributed throughout the country, and so if your area runs out of Tamiflu, then there is nothing you can do about it. You can't order anymore. People have to try to get it from somewhere else.
So that is actually kind of smart.
It is smart. They still make a ton of it, but they don't. It's not just continuously manufactured. So pointless information for you to know. Just because.
You might remember